Now we discuss about mycotic infections. Question number 1 is, all of the following statements about thrush are true. I am reading the correct options. The true options are, it is characterized by a plaque of proliferating epithelial and other cells. So it is characterized by the plaque of proliferation of the epithelial and other cells. It is a complication of the immunosuppression or systemic disease. Second thing is, it is a complication of the immunosuppression, okay, or it is a result of the systemic disease. Third one, it can affect neonates in an epidemic fashion. Next question is, a 32 years old adult male presents with a chronic suppurative lesions on the angle of the jaw. Microscopic examination shows small abscesses immediate beneath the epidermis with moderate growth of the epithelial cords. In the abscess, there are oval unicellular organisms measuring 20 micrometer in diameter and having a thick double refractive cell wall and cytoplasm containing refractive granules and vacuoles. Which of the following is the most likely diagnosis? It is blastomycosis. White patches seen on the buccal mucosa consisting of pseudomycelium and chlamydiospores with a desquamated epithelium adjacent to it. The patient is suffering from candidiasis. Once again, white patches seen on the buccal mucosa consisting of pseudomycelium and chlamydospores with a desquamated epithelium adjacent to it. The patient is suffering from candidiasis. Next, if the reaction is associated with candidiasis. Candidiasis is a complication of all of the following. Which are the complications? Candidiasis is a complication of all of the following. The answer is prolonged antibiotic therapy, corticosteroid therapy, and immunocompromised diseases. Next, thrush refers to acute pseudomembranous candidiasis. Always remember that is acute pseudomembranous. Okay, candidiasis. Next, phycomycosis is also called mucormycosis. Okay, phycomycosis is also called as mucormycosis. A deficiency of which of the following cells can predispose to candidiasis? T lymphocytes. A deficiency of which of the following cells can predispose to candidiasis? T lymphocytes. Candida infection is not seen in geographic tongue. So in geographic tongue, Candida infection is not seen. White raised painless areas when on peeling exhibit painful erythematous areas in case of oral thrush. Okay, so white raised painless areas will be there when peeling exhibit painful erythematous areas are suggestive of oral thrush. Danger sore mouth is caused by Candida albicans. Okay, danger sore mouth. It is caused by Candida albicans. Clinical diagnosis of candidiasis is confirmed by demonstration of the mycelia and spores in scraping. Okay, clinical diagnosis of the candidiasis is confirmed by demonstration of these mycelia and spores in scraping. Then thrush responds to nystatin. The microorganisms most commonly cultured from a chronic bilateral ulcer at the corner of the mouth. It is usually due to Candida. Chronic bilateral ulcer at the corner of the mouth is due to Candida. Okay, a patient is having severe mycotic infection, diabetes mellitus and cellulitis, is suffering from mucormycosis. Okay, suffering from severe mycotic infection and diabetes mellitus and cellulitis. Okay, it is suffering from mucormycosis. The drug used to treat oral thrush is miconazole. Oral thrush develops in infant at 2 to 6 weeks. Always remember 2 to 6 weeks oral thrush develops in infants. Next, Candida infection is involved in median rhomboidal glossitis. Okay, then prolonged use of antibiotics in children can result in candidiasis. So antibiotic is that makes candidiasis. Okay, then not makes, it causes candidiasis. Prolonged antibiotic use can cause candidiasis. Next, candidiasis is associated with the danger is chronic atrophic candidiasis. Candidiasis which is associated with the danger is chronic atrophic candidiasis. Next, Darling disease is histoplasmosis. One important question, Darling disease is histoplasmosis. Which type of candidiasis is associated with the leukoplakia? So the candidiasis associated with the leukoplakia is chronic hyperplastic candidiasis. Okay, chronic hyperplastic candidiasis is associated with the leukoplakia. Then vascular involvement and thrombosis is seen in mucormycosis. The yeast which shows thick gelatinous capsule and positive for mucicarmine is the yeast which shows thick gelatinous capsule and positive for mucicarmine is Cryptococcus neoformans. Okay, Cryptococcus neoformans. Non-separate hyphae with a tendency to branch at a 90-degree angle is a characteristic of mucor. Non-septate hyphae with a tendency to branch at a 90-degree angle is a characteristic of mucor. Oral candidiasis is divided into primary and secondary infection. Antibiotic stomatitis is the other name for acute atrophic candidiasis. Okay, antibiotic stomatitis is the other name for acute atrophic candidiasis. Then Mickey Mouse ears is a histological feature of coccidioidomycosis. Paracoccidioidomycosis. Mickey Mouse ears is a histological feature of paracoccidioidomycosis. Okay, then it is paracoccidioidomycosis. A debilitated patient on oral penicillin has white lesions. A debilitated patient on oral penicillin has white lesion that can be stripped away from the tongue, leaving a raw surface. The patient probably has candidiasis. Silver stain tissue biopsy of the uncontrolled diabetic patient with a sequestrating alveolar segment and nasal pus discharge show large, long, non-specific hyphae with right angle branching. What will be the diagnosis? It is usually of mucor